Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Chiropractor. I'm here with Coach John, who is part of our team that I refer patients to because he pays close attention to the form, which is so important to me as a doctor who treats patients with injuries due to sports primarily. So with that said, we are covering the head and upper body part of your squatting form. We've already done the other ones. We'll make sure we have the reference to them. And with that said, what are some of the things we need to watch out for when it comes to squatting there?
Okay, so we've gone from the bottom up, right? We've gone from our knees to our core, our pelvis, to our upper back. Now we're gonna go from our shoulders to our neck. With the shoulders specifically, if you think you've advanced enough to form a back squat correctly, and you're squatting and say you feel like, man, I feel some pain in my elbow after squats, it doesn't make any sense. We probably don't have the requisite shoulder mobility to get into that position. If we are stuck here, we're going to be relying on a lot of laxity from this elbow joint to try and get us into position and grab the bar. So that's number one, make sure our shoulders are good enough to get in a good position. Number two, our neck. So when we're squatting down, we don't want to be craning up, looking down, looking at ourselves in the mirror, moving around. I think it goes to show that many people should know this, but maybe let's just cover it just in case. So when we're squatting down, I'd recommend picking a focal point about maybe 45 degrees down to the ground, or wherever you feel is neutral as in having a packed and neutral spine, circle spine. So when we have that focal point and we're squatting down, I'm keeping it all the way down and up. I'm not looking up, I'm not looking down. That's why I'd recommend not squatting in a mirror, because the mirror, your focal point is moving as you are moving. So it's going to be a little difficult to try and maintain a set eye position. Now, if you are advanced enough and you're trying to correct yourself, like myself, if I'm like, man, I feel like I'm shifting when I'm squatting, or I feel like my knees are caving in a little bit, then okay, we can try to play with the mirror. But I would not recommend a mirror for advancing in the squat in the sense of getting better at performing different movements as such.
So John, what's the situation with the elbows again? I totally, of course that becomes more of an issue if people are squatting with weight. Right?
Yes. So like I said, there's different ways to perform a squat. There's a goblet squat, there's front loaded squats where we have a front rat squat, or a zercher squat, different squats where we're loading in the front. In that case, our elbows aren't going to be a problem. It's going to help us stay more upright. When we progress to a back squat, specifically a high bar back squat or low bar back squat, we're going to need some requisite shoulder mobility to get into the right position and keep our back tight. If we don't have this mobility in our shoulders, we're going to start relying on this elbow joint to lax a little bit so we can grip the bar and keep it stable above our necks. Another thing, the pad that people like to put on the squat bar. I would highly recommend you not use it. Not from a meathead, no. I would recommend you don't use it because it's going to place that weight a little bit further back. Maybe not by a lot, but it's going to be enough to offset the weight and offset your balance. Where, let's say we put a weight further back from your neck, you're going to have issues grabbing it, your center of mass is going to be off, it's going to create a host of problems much bigger than the pain you're going to be feeling on your neck. Now, if we need to start with it to maybe get accustomed to the movement or something, we can play with that. But I'd highly recommend that people move away from the pad as quickly as they can. Or just move the load from the back to the front. Then you're not going to need a pad, and we can start playing with our wrists. But like I said, highly would recommend not using a pad.
Now this is my heads up here from my perspective. If you're using your neck to lift yourself from a down squat, then you're not doing it correctly. So that just means if you have any weight on your back, you need to decrease that because clearly you're not using the right muscles. So squatting, what part of the body, John, would you say squatting, the people should feel their muscles?
So
Well,
Of course, your legs.
and your butt.
And your butt, you should honestly be feeling it everywhere. That weight is being, if you're doing it correctly, it's being transduced through your entire body. So you're going to be having effects, muscular effects and strength effects everywhere. It's going to be systemic. It might not be as drastic as your legs, but there's going to be an effect. Some squatters, like I referenced in the previous video, have different squatting styles, where their chest is a little more inclined, they're a little more upright. That's going to dictate where a little more percentage of the load is. We can't dictate whether, if people say a front squat targets my quads more than my butt. Yeah, maybe a little bit, but it's not going to be very noticeable. But if you are a squatter with long femurs and you need to incline your chest more, you're going to be putting those glutes and those hams in a little more of a stretch, which could dictate whether you get a little more growth, and you might feel a little more in your butt. If you have a longer torso and shorter femurs and you're a little more upright, then that load is going to be a little bit more distributed to your quads, so you're going to feel that a little more. We can play with that a little bit, like I said, with front squat and back squat, but if your anatomy is going to dictate that a little bit more than not.
Very good. No matter what you do, keep that barrel in mind. We've been talking about it in every single video. I know I have in every single video I've done. And once again, the barrel that we keep referring to is what's going to save you, not save you, but safeguard you. That would be the good word, because it's not going to prevent it. It's just going to minimize the amount of injury you're going to have if you do it correctly. Now, let's say you don't injure yourself, but the next day after a squat, you really feel it in your neck. That means you didn't do it correctly. So that should be a clue, wouldn't you say?
Yeah, if we're feeling it in our neck, if we're feeling it in our low back,
right.
It's really, you're really going to want to mainly have localized soreness to your legs. That's what should be working your legs and your butt. Your spinal erectors have to work, a little bit to keep your barrel in mind, but it should not be excessive. If it's excessive soreness, I know when I first started squatting, I was a little more overzealous and I wanted to get stronger and stronger. When I first started, between sets, I'd have to lay on my back because my low back was just tight and inflamed, and it was just locked up.
Oh my gosh!
You definitely don't want that. You don't want that because you're not in a good spot.
Now, one more thing it just occurred to me. There's a difference between feeling it in your butt and feeling it in your hip. This is your hip. This is not your hip. So if you're feeling it here, you did not do it correctly either. Chances are you have to play with your feet.
Yeah.
Either it needs to go out, or maybe it was out, you need to bring it in. But whatever it is, you don't want to mess the connective tissue around the ball that sits in the socket. Anyway, I hope these videos help you do your exercises correctly, because it sure is not fun when you have all the best intention in mind, you go work out, you injure yourself, now there's a setback, now you're afraid, and then all that stuff. It's a lot more fun to do it correctly, pay close attention, and remember, you're in charge of your own life and your decisions, so make the good ones. If you like what you saw, please subscribe to the YouTube channel and use all the platform that's going to be different platform handles that we have in the description box, as whichever one works best for you to contact us. Shoot us an email, whatever works out, and let us know what you're thinking. Thanks for watching, and thanks, John.